Hey, it's Rowan. I'm 10 years on T and 10 years post-op surgery. So I thought I would come back with an update about, how those kinds of things are at. Um, Disclaimer though, I have over the course of the last 10 years had roughly about 2 years in total of time off of testosterone for various reasons and various lengths, mostly due to access issues. All due to access issues, really. And the longest span was a bit over a year. So I got to kind of see what my body is like going back off of testosterone for a while. I did have a hysterectomy um, 6 years ago now, and but I had my ovaries left in, and so basically when I'm off testosterone, I revert back to my old hormones, and I'm able to stay healthy, and I don't know, I just worry less about access to testosterone because it's an issue where I live. Um, so yeah, the first thing I guess is voice. I don't think that my voice has changed a ton, and since my last testosterone update, which was I think 2 years post-op, it fluctuates based on mood, and I think I just try less to control my voice because I haven't cared about passing for so long. Um, my singing voice never really, I don't know, like I never got my range back. I didn't really try though, so that's mostly on me. I do feel like I can trust my voice to hit the notes I'm thinking of a little better than I could, maybe a year post or start after starting. But I just never really cultivated the relationship with my post testosterone voice that I thought I would. Acne's not really a thing anymore. The first 2 years probably were kind of, just the puberty phase of HRT, and I don't really deal with the acne that comes along with that anymore, which I'm so glad for. This is my hair, 10 years on T. Well, I will say that when I'm off of testosterone for a while, it thickens back up because I've definitely had some thinning. And when I was off of testosterone as well, I lost a lot of my body hair, which I also did not end up getting nearly as hairy as I hoped that I would. I remember thinking that my belly hair would connect with my chest hair, and it never did, which is, I'm still a little sad about that. I wanted to be a really hairy person, and it's just not in my genes. This is my beard at 2 years, 10 years. I did do minoxidil for some length of time, like 2 years on testosterone. I was hopeful that it would fill things in, and I don't know that it really made any sort of difference for me. Let's see. Body composition is pretty dependent on hormones and lifestyle. I don't work out at all anymore. My job is pretty physical, but I don't, lift weights or anything like I used to. And this is what I look like in my 30s, and 10 years on hormones, and I feel pretty comfortable with it. My appetite is, it's been leveled off for years, but I do notice that when I'm off of testosterone for a length of time, I notice a lack of appetite. It's harder to eat, and I think I don't know if I lose weight easier or if it just, it being harder to eat makes that happen. But I do tend to lose weight when I'm off of testosterone. I only fluctuate like 10 to 15 pounds, 20 if I'm lucky, but I just don't worry about my body shape that much anymore. I don't really care about food except for, getting enough to stay well. So I don't care that I have more of an appetite anymore. My energy is definitely affected by my hormone levels. I can work harder and I'm stronger. I have just more oomph to give when I have testosterone. And it's it's a drag when I don't, because like I said, I work a heavy job. I also have 2 dogs that I like to walk a lot, and I appreciate the energy that testosterone gives me, and I miss it when I'm ever late on a shot or whatever. My mood in general, I feel, is also pretty affected by my hormone level. I have just more patience and fortitude, I guess, when I have testosterone, and I deal with more anxiety and depression when I don't have testosterone. And just, my threshold gets a lot lower, so I feel like I'm my best self at a certain range, which for me seems to be like 700-800, which I guess is pretty average. But so yeah, there's that. Since I'm also 10 years post-op, I thought I would give an update on my chest as well. But obviously you can see, how the color has ended up after all this time. It's pretty flat. I can't feel much except for in this area, which I always could, and kind of knew I always would. For scar care, I took care to keep my scars out of the sun a lot for the first several years, especially in the first 2 years. And in the first year, I did massage and even used silicone strips for a little while. And I was really concerned about range of motion and not stretching my scars and stuff, which my range of motion is completely normal. I do stretching and stuff, so it's all good. I never did end up getting any more sensation than probably my 2-year post-op update. Still have a lot of numbness kind of through here. My nipples never really regained much. If anything, a slight bit of pain sensitivity, but that's about it. Still numb here, and then this one's even number than the other, which has been fine by me. Yeah, being post-op is really great, and kind of I feel like all I've ever known now. I am totally at peace with my scars. I have started playing around with tattoos over them, but I don't feel any personal motivation to hide them. I do feel a social motivation sometimes because of where I live, but I don't feel self-conscious about my scars, except for in the case of concerns about safety. So we'll see. I may end up doing covering them up just as part of a cool chest piece, but that's the motivation would be to make art on my body rather than to hide my scars. That is all I have for this update. I may or may not make another video in regards to gender identity and dysphoria and where that's at these days, because that's also shifted over the years. So we'll see. Who knows when the next time I'll get to a video is, but I don't know. I thought it mattered to give a 10-year update since that's a good benchmark. So, until next time.